Parents have been weighing in, asking me whether the portions of food served to their children in restaurants, sometimes at home, are so large that they're contributing to the problem of being overweight or obese. Well, let me chew the fat and provide some information on what I call portion distortion. Overeating is everywhere nowadays. In fact, it's easier done than even talked about. And when children overeat, well, yes, they're going to put on extra weight, especially if they're eating high saturated fatty foods or high sugary foods. And with that weight gain, they're going to set themselves to be at risk for high cholesterol, high blood pressure, diabetes, and even up the road, heart disease and stroke. So you might think that food labels, which give you the right serving size, are the right way to go to prevent portion distortion. But unfortunately, what's on a food label and what ends up on your child's plate may be two totally different things. So what do I recommend? I recommend you use your hand, or you use your child's hand to determine the right serving size for your child. For example, a clenched fist represents about a cup, which is the amount of cereal, rice, fruits, or vegetable that a child could put in an average meal size to be the right portion. In addition, the palm of your hand represents the entree portion for meats, fish, chicken, and the tip of your thumb or your child's thumb should be the amount of mayonnaise, salad dressing, or even butter that they add to a meal. It's also a good idea, parents, to proportion the right serving size on the plate before your child sits down at the table so they're not trying to serve themselves, because that's where they overload their plates and that's where portion distortion starts. It's also a good idea to serve a meal on a smaller plate with the right portion size rather than put the meal on a larger plate, because your kids are more apt to ask for seconds. Finally, parents, you want to be good role models and not ask for seconds and demonstrate your own portion distortion. For example, if you're going to a fast food restaurant and you decide to supersize, hopefully that's not for yourself, but because you're going to share that meal with your child, or because you're going to save half of it to eat later. So that hopefully tips like this will portion out just the right amount of information when it comes to knowing a little bit more about what you can do to reduce the risk of portion distortion in your entire family. This is pediatrician Dr. Lewis First from the University of Vermont Children's Hospital, reminding you to always be first with your kids.